All right. So, all right. Well, we're going to get started. So, my name is Ronald Piasechin again. For those that do not know me, I am the president of Niagara Pride. We have a couple of Niagara Pride members on the line, so shout out to all of them as well. And they're also representing different agencies. I know Sue is on. Sue represents GLIS as well. So always great to see Sue on here. Justin and Jean are also from Niagara Pride. So always great to have other members and board people on board. So this is our inaugural Lunch and Learn series. So welcome everyone who is on today's call. The goal of the Lunch and Learn series is to bring community providers to the table in a virtual setting where they will be able to present information with regards to what their agency does, if they have any specific LGBT programming, but it's not a requirement that you have to have LGBT specific programming. But it's great if the agencies are also affirming and welcoming of LGBT clientele. So that's always a very positive thing. And we have noticed in the community, and I think our years running Niagara Pride, and our predecessor organization was Niagara County Pride. One of the biggest things that we have always heard when it comes to providers is the lack of knowledge in the community as to who is an affirming and a supportive ally of the LGBT community, or who is running specific LGBT programming. That has been a constant battle, I believe, in the county. Erie County seems to do a nice job with having those resources more available, or having a directory of who's out there providing what services. Niagara County seems to either not have a lot of information out there, and it's kind of disjointed whatever information is available. So we're hoping that this Lunch and Learn series brings community members together with providers and affords that opportunity to learn more about what is available. And so today's presenters, we were scheduled to have four, but I believe the fourth presenter may be having some technical issues, so they may or may not be on. But we have Christopher Phillips from the Center of Elder Law and Justice today. Elizabeth, I'm going to unfortunately probably butcher your last name, Elizabeth Diachuk. Oh, Betsy, you're muted.
In the wrong place. Diachin.
My apologies.
No problem.
So we have Betsy from the Unitarian Universalist Church of Niagara Falls. We have Jody McKay from Niagara County Department of Mental Health and Substance Abuse Services. And she'll be speaking about crisis services as well, kind of covering those programs. And we also had Shiloh Wallace scheduled from Community Health Center of Buffalo, Niagara Falls, and Cheektowaga. I'm hoping that they'll be able to come on the line, but just to give a little bit of information about Shiloh's program, the Community Health Center of Buffalo, Niagara Falls, and Cheektowaga is a medical providing organization. They have primary care doctors, other medical services that they provide, but they also have on their website, and they do a lot of work specifically for LGBT clients, just being very aware and mindful of the unique health needs of the LGBT community. So we thought that they would be a great presenter to make people aware of their services. So hopefully they come online, but if not, we'll try to get them for a future Lunch and Learn as well. So we're going to start our presentations with Christopher from the Center of Elder Law and Justice.
Great, thank you so much. And I guess I'll try and share my screen here. I'm sorry if it's a little overkill with the PowerPoint, but if you're joining us live, hopefully it's helpful, or if you're watching the recording, hopefully you can get something out of it. Yeah, thank you again for organizing this, Ron, and this is really great. I'm really excited to be with all these advocates and this great organization. So my name is Christopher Phillips, and my pronouns are he, him, and his, and I'm a staff attorney at the Center for Elder Law and Justice. And today I'm going to talk to you a little bit about just our services here at the agency in general, and then a specific program that I've recently launched targeting LGBT older adults. So hopefully you all can take something from this, and if you have questions, stop me at any point. So if you haven't heard of us, we're a legal services agency located in downtown Buffalo. Our main offices are there. However, we do serve around 9 counties of Western New York. So that's Erie, Niagara, Orleans, Allegheny, Chautauqua, Cattaraugus, Wyoming, Genesee, and Steuben counties. So our main office is in downtown Buffalo. We do have sort of satellite offices in Niagara County and Chautauqua County as well, and great advocates there. Generally speaking, for our services, there are differing sort of income and age requirements or restrictions depending on the program. Generally, the agency serves older adults, disabled individuals, or low-income individuals. Basically, if you're 60 plus and are living on sort of a limited income, you're going to qualify for most of our services. But if you have questions regarding specific eligibility for certain programs, definitely give us a call. We can help screen for that. So here at CELJ, we have a number of services that we offer to the general public. So these are not the LGBT specific services. That's what I'll touch on next. But of course, LGBT older adults are definitely included in all of these practice areas as well. So this ranges from things such as healthcare advocacy, so health insurance, Medicare, Medicaid, private insurance. If you're having issues with that or have questions about your insurance, health insurance, definitely we can assist with that. We have a wonderful elder abuse prevention unit that really helps with financial exploitation, physical exploitation, orders of protections, powers of attorney issues. We have a consumer protection unit, which is really great for if there's any debts out there that you can't afford. You're being sued on a judgment, for example, credit card debt, something like that. We also have a Refugee and New American Services program to help individuals with naturalization, legal status, things like that. The agency also is the co-trustee for a great program called the Western New York Coalition Pooled Trust. And this program is a trust arrangement that allows disabled individuals to sort of put part of their income into this trust account and maintain their eligibility for certain public benefits. So whether that be Medicaid or some other benefit with income limitations, that's a great program as well. We have a foreclosure prevention project in a housing unit as well. Landlord-tenant issues, if you're having issues with that, or we can assist with that. And then income maintenance, so if you have issues with your government benefits, denial notices, things like that, those are all things that we can assist with. So that's sort of big picture of the agency, the kinds of work that we do, some other things here and there, but that's the big picture. And really, I'm proud and really happy to be launching this new initiative as of September 2020 that provides free civil legal services for LGBT older adults. It's made possible by funding from the Borchard Foundation Center on Law and Aging. And we're really pleased to be offering this program. So there are some services under this program, in addition to the general services I just went over, that are specific for the LGBT older adult community, and that we don't typically offer to the general practice areas, general clients of the agency. So this includes things such as advanced planning, so powers of attorneys, healthcare proxies, last will and testament. I really am trying to focus on this because I think all people should have these documents, especially in times of COVID. It's really showing the importance of these documents. And so We really like to see them in place. I'm finding that in my work with the LGBT older adult community, there's sometimes complicated family dynamics for everyone, but maybe particularly for some of us in the LGBT older adult community. And so it's really great to talk through that with someone if you want to change your plans or who you want making decisions for you. We can also help with name changes or gender marker changes. This is great for transgender individuals or individuals who are just looking to change their legal name or gender marker on their legal documents. We can help with that process. We can also help with discrimination complaints. So if you've been discriminated against because you're LGBTQ, we can definitely assist with that, whether it be filing a complaint with the Division of Human Rights or maybe in a court. We can also help with long-term care resident advocacy. So if there's an LGBT older adult who's living in a skilled nursing facility or adult care facility and maybe not getting the greatest treatment or what have you, we can definitely intervene and help with some advocacy there. And then the last sort of service is a legal health checkup, we like to call it. Just basically having a conversation with folks to see how they're doing, if there's anything that we can assist with, that an attorney can maybe intervene and help with. So these are some great services. If you're at all interested in any of these or would like to chat about them more, I'd be more than happy to connect with you about that. Currently, due to the funding that we have for this program, we do have some eligibility criteria. So we generally look for the following three things: an age limitation. So generally adults ages 50 years young and up. We look for some income as well. So about 200% of the federal poverty level. For an individual, that's a little over $2,000 a month. And then finally, self-identifying as lesbian, gay, bisexual, transgender, queer, questioning plus. So if you don't fit into one of these criteria or any of them, that's okay. You can still give us a call. We can definitely consult with you. And if we can't assist, maybe we can find someone, connect you with someone who can. But definitely feel free to give us a call. And so generally, I mean, when I'm talking with individuals, the question comes up, like, do I have a legal issue? A lot of people think, oh, I don't really need a lawyer. I don't have a legal issue. But I like to sort of have people think through some questions, just evaluate their current needs first, and then sort of their future needs secondly. So in terms of your current needs, you can ask yourself questions such as, can I afford to go to the doctor? Do I have stable housing? Do I have enough income to pay my debts? Does my legal name conform with my gender identity? If the answer to any of these questions is no, I mean, that's something that definitely, if you'd like to address, we can potentially talk to you about. If you need better health insurance, you need a legal name change, or assistance with housing. And the same goes for, looking toward the future, this advanced planning that I was talking about. Is there someone who can help me pay my bills if I cannot pay them? Who's going to make medical decisions for me if I can't make them myself? And who's going to inherit my property if something happens to me? These last two questions about medical decisions and inheriting property, if you don't have anyone that you've selected, the law is going to appoint someone based on your relationships, right? And if that's not what you want, that's something you have to actively change. So definitely just take a look. I know everyone's really just trying to deal with the pandemic and everything that's going on right now, but really if you take time to sort of reflect on your current needs and your future needs, if you see something that's not adding up, please feel free to give us a call. We have some content that you can look out for on our website. So for those of you calling in, you can find us at www.elderjusticeny.org, or you can also find us on Facebook at www.facebook.com/elderjusticeny. I believe it's a little cut off on my screen, but it's here for you. You can find us on there. We have periodic presentations such as, advanced planning for LGBT older adults. We have a blog post as well. I'm trying to push through content to help you. And If you can think of anything that you'd like more information on, we'd love that feedback as well and create that content for you. I also just wanted to flag another resource that we have here at the agency. It's a free senior legal advice helpline, which is great if you have like a discrete legal issue. It's a brief consultation with an attorney, about 15 minutes, where you can get your questions answered and see if you need a lawyer long-term. Generally, this service is offered for individuals age 55 and up. You can speak with a live attorney from 9 a.m. to 11 a.m. Monday through Friday, or you can leave a message and have a call back. That phone number is 1-844-481-0973, or you can email this helpline as well at helpline@elderjusticeny.org. And finally, here's just my contact information. If you want more information about any of these services, or if you're interested in any of them, please feel free to give me a call. You can feel free to call our main intake line at 716-853-3087. My direct extension is 283, and I'm sorry there's a emergency vehicle. I don't know if you can hear it in the background, but what are you gonna do? Again, my direct extension is then 283, or feel free to shoot me an email at cphillips@elderjusticeny.org. So thanks again for having me, and I'm looking forward to hearing everyone else's pieces as well.
Perfect. Thank you so much, Christopher. That was some really good information. And stuff that I didn't even know that I will probably be referring my mother to, actually. So that's always a really good thing. So thank you so much, Chris. All right. So next on our list is Betsy. If you'd like to go ahead and unmute yourself and tell us about the Unitarian Universalist Church. Oh, Betsy, you're still
There,
on.
I'm on now. I'm sorry. First, I couldn't find my mouse, then I'm looking at the wrong place. The Unitarian Universalist Church of Niagara is at 639 Main Street. That's close to the Falls, in the same block as the main post office. We, for a long time, have been a supporter of LGBTQ people. We have hosted groups there over the years, and we certainly have performed marriages once they became legal in New York State. We're so small now that we don't have a permanent minister. In fact, I see Reverend Susan Frawley, who speaks to us once a month, is going to be one of your speakers today. And so we do have, though, members who are legally able to perform marriages, whether they're same-sex marriages or any kind of marriages. The Unitarian Universalist Church in general is not a creedal church. It is based on consent of all the members to affirm things. And I just thought, I wasn't sure what all you wanted, but I thought I could read these a little bit. We have many members who are still active in other religions, like Buddhists, or we even have atheists and other people who are interested in that. But they come to our church for the complexity and the interaction between the different people. So our first covenant is that we, the inherent worth and dignity of every person. That's one thing that we believe in, and certainly since your group has sometimes felt discriminated against, I think that was an important one to remember. We believe in justice, equity, and compassion in human relations. We believe in acceptance of one another and encouragement in spiritual growth in our congregations. We have a free and responsible search for truth and meaning. That means that each individual can determine what their religious belief is going to be. It's not handed down through a specific way. We meet on Sundays at 11 o'clock in the morning. At the moment, we do have a Zoom program that you can link into, but we also do have people who are physically present because we have such a large building and so few members, unfortunately, at the moment, that we are able to do that. We can, in fact, move to 2 separate rooms, large rooms where the audio is available. So we have continued to be able to do that. At the moment, we don't have any groups meeting at the church specifically for the LGBT group, but certainly in the past we have, and we've enjoyed having them being there. I'm not quite sure what all that I can say otherwise. We don't have any special programs for you, but certainly we're open to entertain anything that might be brought before us. So you can, we do have a website, and under the First Unitarian Universalist Church of Niagara, and you can look that up or check us in any way. So if you put First Unitarian Universalist Church of Niagara together, we now call ourselves the Fun Church, F-U-U-N, because we do believe that we can have a lot of fun and still be religious. Thank you.
Thank you, Betsy. And yes, I can personally attest to the fact that in the many incarnations that our organization has had before finally becoming our own separate organization, we were Rainbow City, and then we were Niagara County Pride, and then we became Niagara Pride. And I know that the Rainbow City Coalition was meeting at the UU Church for well over 10 years at this point. And I probably became involved with Rainbow City probably somewhere 7-8 years ago, somewhere around that time frame, and continued on with Niagara County Pride and the Niagara Pride. So yes, to Betsy's point, the church has always been very welcoming, very affirming. They've helped us with different drives and different things in the past. So they are a great organization. So thank you, Betsy, for being on today and presenting about the UU Church. So, and next, our next presenter is Jody McKay from the Niagara County Department of Mental Health and Substance Abuse Services, a long title for an organization, but a very needed organization and a very good organization. So Jody, take it away.
Thank you very much. I was really, really thrilled to be invited to participate in this, and I look forward to participating in your future events. And I get them all mixed up, whether it's a roundtable or a lunch and learn. I think the roundtables are upcoming in March, I believe. But I did send Ron some of our brochures, and I'm just gonna, we offer at Niagara County Department of Mental Health several direct services. So I just kind of wanted to touch on them so that everybody's kind of aware of the services that we provide, because I know a lot of people in the community really don't have an idea. They might be aware of some of the major services, like we have 2 adult mental health clinics that I'll get into in a minute. But I just wanted to kind of touch on, especially like a lot of our home-based services, because sometimes, especially during the pandemic, you know, those are necessary in our community. So I just wanted to kind of touch on all of our services. If you want to kind of think about Niagara County Department of Mental Health and Substance Abuse Services, which is a lot to say, we abbreviated it as NCDMH, but if you want to kind of think about that kind of being like an umbrella term, and under that umbrella, we have all these different services. We have a 24-hour crisis services, which most people are aware of. We try to get our number out there as much as possible. 285-3515. We want everybody to have that. We try and hand out pens and magnets because we want everybody to be able to access the crisis center when they need it. Through crisis services, we offer a 24-hour call center. So we take calls 24 hours a day. We have phone aides that are here to process calls. And then we have a mobile crisis team that will respond if necessary. In the community, you know, obviously we, for our crisis center, we have calls people can call in here if they need referral information. So if somebody really doesn't know where to turn and thinks, geez, I need food for tomorrow, they can call crisis services and we can give them those referrals. If they need housing, we can give them that information. We even have students that call here that are having a hard time, and we can help them to process through their difficulties and make sure that they're linked up with the services that they need. We also get calls from individuals that might be experiencing a mental health crisis, and we will work through that with them. And obviously, we want to make sure that they're safe and that they have the support and the resources that they need. We also get several calls from people in the community that might be calling for a loved one or a neighbor or a friend that, they're concerned about. They might be experiencing suicidal ideations. They might have, concerns for them for whatever reason. So we get calls 24 hours a day. We can respond 24 hours a day. We don't have an answering service. Our phones are always open. So crisis services is there for everybody 24 hours a day. Through crisis services, we get calls that sometimes if somebody doesn't rise to the level where we might not need to respond at a mobile crisis on site, but if we get somebody that calls in that might need some help in linking to services in the community, they might need help with support groups. They might need help with, I mentioned housing or food or some of the more basic needs. We do have services that are home-based called like crisis services coordination, where we would have a licensed clinician who might be like a licensed social worker, a licensed mental health counselor, it could be an RN. They would reach out to that person within a day or so and try, work with them on a short-term basis, get them linked up with some services. Obviously, we want people to function at their highest level possible in the community. So that's what crisis services coordination would do. We also, through crisis services, we have forensic case management, which those referrals really come from like probation or parole, or sometimes Niagara County Jail. It's kind of like if you want to think of it like a bridge service to provide case management with kind of a therapeutic flair to help people transition back into the community and make sure that they're linked up with the services that they need to be able to, function safely in the community. We offer on-site education and training also, which our website is on some of the brochures that I had emailed to Ron, but at niagaracounty.com, if you go to the niagaracounty.com website, and then you can access departments. And if you go to mental health and substance abuse services, all of our brochures, all of our contact information for all the supervisors are on there. And also if anybody from their agency feels like they might benefit from any on-site education or training, there's also a request form that you can fill out on there. So that's right on the web, and that just then goes right into our administration, and that would be assigned accordingly. We also do critical incident debriefing. I'm not sure if everybody's aware of that. That's something our crisis services staff does. If an agency or an individual in the community experiences a traumatic event, and if they need help processing that, if they need some support, we will respond immediately with a team to assist either that individual, or we've had agencies call us where we've been, we've been at an agency for an entire day. If, schools, for example, if there's, a tragic death or something, we certainly can provide that service to the community, and that's free of cost. So that's crisis services. We do offer, we have 2 adult mental health clinics that are integrated, which means that they provide mental health services, they provide substance abuse services, and they also provide some basic medical services. Nothing too in-depth, but they can help people, take their vital signs. We have nurses on staff, and obviously the nurse practitioner that can do basic physicals, things like that, so that we can make sure we're doing our best to serve all the needs of the individuals that come in for our services. We do have one thing to remember for our walk-in clinics. We have in the Lockport Clinic, which is located on Upper Mountain Road. We have 10 a.m. to 2:30 p.m. Monday through Friday, where we have open access. So if anybody feels like they needed, if they wanted to see a therapist that day, they can just walk in and, get an intake done that same day. And in Niagara Falls, our clinic is located at the Trot Building, which is 9 a.m. to 3 p.m. are the walk-in hours. So again, individuals can walk in and get an intake done that day and see a therapist. And also online on our website through the adult integrated care clinics we have to try and make it as user-friendly as possible. We have like intake packets. So if people don't want to sit in a waiting room, especially during COVID, you can complete those at home and you can always fax them in, or you could come and drop them off. So that's our clinics. We also have our single point of access, and I don't know if people have heard of that, but SPOA basically is a collaboration of a whole bunch of different community providers that work together to make sure that individuals with mental health diagnoses are served. We have a SPOA coordinator that will monitor their services and make sure that they are receiving the services that they need. A SPOA application, if somebody's in need of housing and case management, they could fill that out. And our SPOA coordinator would then monitor them, make sure that they're linked with the services that they need to be. Our assisted outpatient treatment, we don't have a brochure per se for assisted outpatient treatment. That's often not a program that people want to join. That is a program that really serves our seriously and persistently mentally ill population. So those individuals in the community that are really difficult to serve. The AOT application is actually on our website. So if somebody is having difficulty, attending services, but their mental illness is interfering with their life, it's making them a danger to someone else. If they have been incarcerated or if they've had several hospitalizations and they're unable to link with services and maintain that service, they can be referred to the assisted outpatient treatment program. Some of our home-based services, I've been here at Niagara County Department of Mental Health for 7 years. And actually it was 7 years, like yesterday, I think it was. We have grown quite a bit. So since I've been here, we have developed all of our home-based programs, and that's something that's near and dear to my heart because I know that not everybody is going to fit into the mold of wanting to go into the clinic. Not everybody's comfortable with that. So I love the non-traditional social work, meeting people in the community kind of where they're at. In our home-based services, the crisis services coordination, the forensic case management that I mentioned earlier kind of fit under that umbrella. We also have the hospital diversion program, which I did put a brochure. I gave that to Ron. In our hospital diversion program, we have 2 social workers that work off hours. So they work non-traditional hours. One of them works 1 to 9. The other works 12 to 8, 3 days a week, and then works all day on Saturday so that we can really kind of meet clients in the community if we have individuals that work or, to be able to provide those off-hour services. And hospital diversion really provides, short-term therapeutic intervention with the goal of making sure that that individual, when they're before their case is closed, of course, make sure that they're linked with services that they need on a long-term basis. So we have 2 social workers that work in the hospital diversion program. One of them is linked with Niagara County Department of Mental Health, collaborates with community missions and with the Mental Health Association on the Hope House. I don't know if people have ever heard of Hope House in Lockport. It's at 344 Walnut Street. And we actually, through our hospital diversion program, we have a therapist that works at the Hope House. So every individual that comes into the peer recovery respite center there at Hope House, we have a therapist that will assess them and determine needs and, try and help them. And then of course, assist them with any therapeutic needs when they transition back into the community. The Hope House, as I said, is at 344 Walnut Street in Lockport. It's a 4-bed peer recovery respite center. So basically, if an individual is in a mental health crisis, they could call crisis services. And a lot of times, we always want to divert from the hospital when it's safe and we're able to do that. Hope House is a really great way to be able to do that. We've had a lot of people that And, you know, I looked through all of our satisfaction surveys from individuals that have stayed there, and it's a really great service for people that are trying to avoid going to the hospital, as long as they're able to keep themselves safe. Hope House is a really great alternative. People can go there for the stay averages 5 to 7 days. So, and they can get the support that they need. There's peers there that can work with them. Their community missions runs the house, and then there's peers there through the Mental Health Association. And as I said, we provide a therapist that goes there to work with individuals. Also, we have the Partnership for Healthy Aging program, which has been around for about 4 years. That's actually a grant funded program, and we collaborate with, it's a triple partnership. So we partner on that program with North Point Council and with Niagara County Office for the Aging. Basically, Niagara County Department of Mental Health, we provide a licensed social worker that provides kind of like the hospital diversion, short-term therapeutic intervention in the community. And then North Point has a behavioral health case manager. So they have a case manager that's going to deal, making sure that individuals are linked with the mental health or the substance abuse services that they need, that behavioral health component. So they make sure that they're linked with those services that they need. And then we have a case manager through Office for the Aging that works with individuals on any aging related needs. So those three workers all partner together to make sure that individuals have all of their needs met. And, you know, obviously it's a short-term in-home program, but we work to make sure that they're linked with all the services that they need prior to discharge. Talked about AOT. Just want to make sure. We also have some youth services. At this point, we have 2 individuals that work out. They work very closely with CPS. They're co-located there. We have one in Niagara Falls that works with. She's our recovery specialist. She works with moms that are born with babies with positive toxicology. So she works on really getting them linked with services. You know, obviously trying to help them maintain custody of their child, make sure that they have the services that they need in place. And then we have a behavioral health specialist that works out of the Lockport CPS office. And all of those referrals come from CPS, but she works with individuals to make sure that they're linked with any mental health treatment. If you know, CPS is intervening with a family that, you know, they might not be linked with any services. You know, our goal is to always make sure that they're linked and they have that short-term therapeutic support to be able to help them to function at their highest level possible in the community. We also work with youth and probation. So we have a therapist that works with probation, and they might send us referrals for individuals that on the assessments that are done through probation might be at risk. So we have individuals in our department that will do mental health assessments to make sure that we can, you know, assess that youth and make sure that they're linked with the services that they need to be. We can make those referrals. I think that's all of our services. Does anybody have any questions about anything? I feel like it's a lot.
You guys do a lot, but you also do incredibly good work. So it's hard being an umbrella organization because, yeah, you oversee so many different things. So it's totally understandable that you would have a lot to present. So no, we definitely appreciate it. But any questions for Jody? A lot of head shaking. No. All right. Well, thank you, Jody, for presenting on Niagara County mental health and substance abuse services. So I'm just going to very quickly introduce Niagara Pride for individuals who are on the line that don't know a lot about Niagara Pride. We are a fairly new organization in terms of being a on our own organization that was incorporated in New York State back in October of 2020. So we submitted our paperwork. We've been incorporated. We are registered with the New York State Attorney General's office, and we are in the process of waiting for our 501c3 We have already submitted that, but we have not been granted that yet. That does take a while for any of you organizations that are 501c3s. You may be aware of the long period of time that sometimes you have to wait for that. But basically our mission is to serve the LGBT community here in Niagara County. So we are countywide, but we also have members and people who have attended our meetings and our events from Erie County, Wyoming, Genesee, Livingston, Ontario County. So we do get a lot of different people from all over attending our services. Prior to incorporating back in October, we were running as Niagara County Pride, where we were a subgroup of the Pride Center of Western New York. And we have continued our mission, which has never changed, even though our name has changed and our organizational structure has. Our mission continues to be the same, that we are here to provide a safe space for the LGBT community, to continue charitable works and educational works, as well as advocacy. So if any of the people on this call have maybe seen some of our postings on Facebook, or maybe have seen some of our community work that we've done, we have held health fairs in the past. We have done free community like picnics and meals around holiday times, knowing the importance of sometimes around like Thanksgiving and Christmas or Hanukkah, that a lot of times individuals are not able to be themselves or bring their significant other to their family. So we offer an alternative LGBT friendly meal so that individuals can come in, share that with their significant other, and not have to worry about having to leave somebody out or not being welcomed or accepted. We've been very fortunate that we've been able to provide picnics and these kinds of events absolutely free of charge to the community. So we are hoping to resume that work once COVID restrictions are lifted and it's safe to go back to in-person services. And we've also been doing a lot of drives and donation gathering throughout our years as Niagara County Pride, and we're going to continue that. We've done backpack drives and sock drives, clothing and food drives that benefit various different organizations throughout Niagara County, as well as even the Ali Forney Center in New York City, which is an LGBT homeless program for youth out there. So that being said, that is just the quick rundown on Niagara Pride. I do want to give a shout out to our next two lunch and learns. We have one coming up on Saturday, February 27th. That one is going to be a 30-minute lunch and learn, and we have two presenters. We have Gay and Lesbian Youth Services is going to be on that call, and Youth Link / Be Prepared. Youth Link is through Kaleida Health, and both those organizations are going to be speaking about LGBT youth services that they offer. And so we decided to do that on a Saturday when we thought we could get more youth people on the call and being able to listen to that presentation. And then our next Friday lunch and learn, which again, these lunch and learn series are going to be the third Friday of every month from 12 p.m. to 1 p.m. It's going to be a Zoom call. The links are already up on our Facebook site. All of the different lunch and learns are done as specific events or individual events so people can log in. The Zoom information is right there. But on our March 19th lunch and learn, we're going to have the Pride Center of Western New York, Heart, Love, and Soul, Horizon Health Services, and Blue Cross Blue Shield will be presenting on their programs and their services. So I know that this is a smaller call today, and we may not necessarily need to go into our breakout rooms that we were thinking. So if there are any individuals on this call, I'm going to say we're going to maybe just bypass the breakout rooms. And if anybody has any questions for our presenters, I'm going to open up the floor now for any questions.